Oh, good morning. We're gathered here today on the traditional territory of Treaty 6, and I acknowledge the Métis people who share a deep connection with this land. I'm joined here today by Angie Triska, who lives near here and is waiting for surgery on her knee, and we'll hear from Angie in just a moment. She's one of many people who are waiting for help from our struggling healthcare system, a system that Danielle Smith had claimed she had fixed. But if you ask any healthcare professional, they'll tell you it's still deep in crisis. Indeed, we know from the government's own annual report that the UCP, in fact, got fewer surgeries done in 2022 than we got done in 2018. We know that wait times to see a doctor in the emergency room are routinely spiking to 12 hours and beyond. And we know that some Albertans are now being asked to potentially pay out of pocket to see their family doctor, something Danielle Smith promised would never happen. That's the current state of healthcare under Danielle Smith and the UCP. And here to share her experience in that system is Angie, and I'll turn things over to her.
So, thank you, David. I am here today with MLA David Shepherd because I believe it is important that people know what is truly happening in our healthcare system. I injured my knee a year ago, April. I got one diagnosis that temporarily fixed the issue, but the pain came back a couple months later. So at the end of June, my doctor wanted me to go get an MRI, which I finally was able to get in November. Results showed I had a complete torn meniscus and my kneecap was detached. So my knee's a mess and I need replacement surgery. In April, my family doctor finally got the referral to the Bone and Joint Clinic. And just last week, I was informed it will be 14 to 16 months before I can even see a doctor at the clinic. So that's 14 months before I'm even able to get in the queue to see a doctor. I asked if there was a cancellation list, and I was told there was none. I'm still young, I'm just 55 years old, but the pain is so bad I can barely walk some days. And the effect of the injuries are taking a toll on the rest of my body. I worked retail as my job, but I can no longer do that because I can't stand on my feet all day. I am limping all the time, and on a busy day, if I walk around a lot, my knee will swell to the size of a watermelon, and my pain is on a scale to 7 or 8 out of 10. I live in a vintage house right here in Ritchie, and so we have stairs, and getting to the basement to do my laundry is a real painful experience. Not just because I don't love doing laundry. I have a family, and I feel that, and they feel the pain too. And my best friend over there, Chip, also feels it because he misses going for walks and our playtimes. I could go to a private clinic down in Mexico and be fixed up, but by the end of summer, but I don't have a spare $28,000 sitting around. During COVID, I got laid off. I work in retail, but I was too concerned at the time, and because my partner has a good job, I figured we would just ride it out, and I would find a new job once the pandemic was over. Now, I'm just in limbo. Should I apply for jobs while I'm waiting for surgery, knowing I will have to take significant time off eventually? Not sure an employer would love that, but I do want to go to work again. The healthcare system is not fixed. If people like me are waiting 14 months or more to get the surgery they need to get on with their lives, this government should stop telling blanket lies to Albertans that the crisis in healthcare is over. It's not even close to being over. And people hoping for prompt treatment to ease their pain should know that the wait list is long and there doesn't appear to be an end to the situation in sight.
Well, thank you, Angie, for coming and sharing your story here today. Albertans, like Angie, have a right to some answers. Along with my colleagues, I wrote to Dr. John Cowell on July 12th, almost 2 weeks ago. We asked for an in-person briefing from him on the state of Alberta Health Services. Unfortunately, just like all other Albertans, we've heard nothing from Dr. Cowell. So I'm calling on him, or the Premier, Danielle Smith, or the Health Minister, Adriana LaGrange, to step forward today, show their face, and explain why Angie and others have to wait in pain for more than a year just to see a surgeon for the first time for an assessment. They can explain why it takes over 12 hours to see a doctor in an emergency. Perhaps they could explain why Albertans are being asked to potentially pay thousands of dollars in fees to maintain access to their family doctor. Thank you, and I'm happy to take any questions.
Well, thank you, David, and thank you, Angie, for sharing your story. I'd like to remind media joining us over the Zoom, you can use the raise hand function on Zoom to join the question queue. That's the raise hand button at the bottom of the Zoom to join the question queue, or press *9, your telephone keypad. Just give you a moment. First question comes from Dean Bennett from Canadian Press. Go ahead, Dean.
Rachel is on Twitter this morning saying that, calling on the government to pass legislation to stop this fee for membership fee doctor access plan at Marda Loop Clinic. Why do you feel that's the best way to go?
Well, Dean, I appreciate the question. And the fact is, we are at a moment now where we have tens of thousands of Albertans who do not have access to a family doctor. So we have seen a small number of these corporate-owned clinics before that were formed and basically formed on the model of charging a membership fee. We are now seeing for the first time a family physician that formerly saw patients at no cost to those patients, just under the publicly funded system, now talking about, now actually advocating, telling her patients they will need to pay a membership fee if they want to maintain that same access. So with the damage that this UCP government has done to our primary care system, driving doctors out of province and out of practice, we cannot afford to let this become contagious. We can't see this spread. So we need legislation to close this loophole, make it abundantly clear that in Alberta, no Albertan will ever be asked to pay any additional fee simply to be able to see or maintain access to their family doctor. Danielle Smith promised this during the election campaign. She said very loudly and clearly, no Albertan will ever have to pay to see their family doctor. So this is our opportunity to step up.
A follow-up, Dean?
Yeah, so if, because it does look like we're in a legal gray zone in terms of the Canada Health Act here. Mm-hmm. If the province does not act and other clinics decide to follow this model of 1 day a week, we'll see people for free, and the other 4 days you have to pay. What do you think is going to happen to the system?
If this model were indeed to spread, and indeed the UCP, again, through their attacks on family physicians and their erosion of the primary care system, have created a perfect situation for that to happen. If this were to spread, then what we are going to have is even more Albertans who are not able to access a family doctor, even more who are going to be facing potentially crippling fees to maintain that access. I saw people that have been talking about this on social media. One woman was speaking about the fact that she lives with disabilities, she has chronic conditions, she has to see her family doctor on a regular basis for blood work, to renew prescriptions. If all of a sudden now Albertans like that are faced with having to pay thousands of dollars in membership fees to maintain that regular access for the basics of what it takes for them to maintain their health, then essentially we have a two-tiered healthcare system. We have people having to pay for access. Now, Danielle Smith, of course, advocated for this in the past, but she claims now that she has had a Damascus moment and that she has changed her mind. So here's the golden opportunity for her to demonstrate that concretely and introduce legislation to close this loophole and ensure that no Albertan ever has to pay additional fees in order to be able to see or maintain access to their family doctor.
We don't currently have other questions on the line, so I just want to go back to you, Dean. If you want to go round two, you're more than welcome to.
Yeah, so I wonder what this might mean if this program goes through. What does that mean? Because you need to see your family doctor also for referrals for MRIs and all that sort of thing, right? What will the impact be on that?
Well, again, if this is allowed to continue in the province of Alberta, and if this spreads, then that means more and more Albertans are losing access to care. Now, we've already seen that happen in so many respects under the UCP government. So many people have lost access to a family physician as the UCP embarked in their war on doctors. We have folks like Angie who are now facing incredibly long waits, 12 to 14 to 16 months, just for the assessment before surgery on her knee. We know that Albertans are facing longer waits in the emergency room. We know that Albertans are facing 4 to 6 weeks just to get a basic appointment for a basic blood draw. So what we will see is further erosion of the system that we've seen under the UCP. In fact, we will see that on steroids. So it is absolutely essential that we make it clear that this model is not acceptable in the province of Alberta. That doctors, if they are going to be billing the public healthcare system to provide care to patients, are not allowed to gatekeep access to that care by charging membership fees.
What's driving this, though, David? When you talk to other physicians, like there's two theories. One being that these are corporately driven and they want to pad their bottom line. The other one is that these doctors are facing very thin margins as it is with overhead and that sort of thing. And this is just, they need to do this to sort of stay above water. What is the experience? What do you think is driving this this fee plan?
So I can't speak to the motives of the specific doctor in question at the Marda Loop Family Clinic. You'd have to speak to them to sort of understand their reasons for making this decision. But as you say, what we have seen in the past is that these have been largely put forward by corporatized clinics. So we had the Coleman Clinic, which has been bought out by TELUS, that was founded on this model. And certainly that was something that the UCP seemed to show a great deal of interest in early on as they raced to implement virtual care through corporation through the TELUS Babylon Now My Health app, indeed paying them more at that time for a virtual visit, a virtual walk-in clinic than doctors were able to collect for seeing their own patients virtually at the start of the pandemic. It took nearly 2 years for them to correct that and get a fair and equal access. And we of course have seen them doubling down on a lot of things. They passed legislation to allow more corporations to be able to bill the government of Alberta directly for medical services, not just physicians, corporations billing the government directly. So it seemed the UCP had some interest in some of these kinds of models. However, what you are quite correct in saying that family physicians also are under incredible strain. And again, this was a decision of the UCP government at the beginning of the pandemic when they tore up the contract with Alberta physicians. They forced through a number of changes that specifically hit family physicians the hardest, particularly rural family physicians, and made it incredibly difficult for them to practice. They failed throughout the pandemic to provide fair compensation for doctors for virtual visits. They were being paid $37 whether they saw someone for 15 minutes or whether they saw them for 45 or 60 minutes. The government of the UCP government did not correct that for an extended period. So they have made it incredibly difficult, made the margins incredibly thin for family physicians to be able to practice in the province of Alberta, even as tens of thousands of Albertans need that access. So what we need to see from this government is a clear plan to actually support family physicians, to support team-based care, which after we brought it out, Danielle Smith suddenly was very interested in perhaps doing as well. So we've presented a model, our family health teams plan, which lays out much of this. We certainly would be happy to speak with the government about it. We would encourage them to look into it. But we need to be supporting family physicians to provide care, not putting them in a position where they have to look at other ways to provide that, like potentially membership fees.
Final question, Dean?
Yeah, I thought they solved this in the last contract, David. Didn't they sort of agree on a kind of a moving to a new pay model that worked for everybody? Am I wrong on that?
So the contract that was negotiated and passed last September essentially just undid all of the things that the UCP government insisted back in February of 2020 when they tore up the contract were absolutely essential. They said they absolutely had to force through these changes or we would be bankrupting the healthcare system. There was no way it could progress without it. Well, in September of last year, Health Minister Jason Copping essentially signed a new contract that basically just undid all of the changes the UCP had made. There were some small incentives, some small amounts that were being paid to try to help make family physicians a bit more whole after the pandemic. But it was by no means a solution to the challenge we face. It was a first step. But largely it was the UCP government just admitting that they had utterly got it wrong and done incredible damage in the process. So what we're seeing across Canada is people are saying we need to invest in primary care. The way to solve that is through team-based care. And we need to see this government bring forward an actual model to provide payment and support for that new model of care and ensure that family physicians are fairly compensated for the essential work they do.
Final follow, Dean?
No, I think that's good. I had a question and can't think of what it was now, so I'm just playing for time here. No, I can't. No, that's good. Thanks a lot.
Okay, thanks, Dean. And with that, we'll conclude today's news conference. Thank you so much, everyone.
Thank you.